So how long have the healthcare programs been running here?
We started 5 years ago, and we have an average of 30 to 50 students per year.
And do they run at specific times of the year, or is it all year round?
Okay, we offer the program in specific times, but we can accommodate anyone, anytime.
And Carmen, I know you've been working hard on these programs. How long does it take for you to put together one of these?
About a year.
And is there a lot of research that goes into that?
There is a lot of research because, for me, I don't know the culture of Mexico all that well. So Carmen has been very gracious, and together she and I have been working on that. So I add nutrition parts, and Carmen helps me to add the cultural and language parts.
So for students that are thinking about coming, how long does each course last?
The classes run in 2-week blocks. Each week is 30 hours.
But students can sign up for as many blocks as they want. For example, our summer course for dietetic students, we want them to come for two-week blocks.
And how many students would you normally find in a class?
It's an average of 5 students per class.
There are also private classes a student could take where it's one-on-one with a teacher.
So now can we discuss what the programs actually include and what a student might expect to get out of the schedules?
Okay, we have 3-hour grammar class in 5 different levels, from beginner to advanced, and we cover the 4 aspects of language: listening, reading, writing, and speaking.
After the 3 hours of grammar class each day, then we have 2 hours of conversation class. And conversation class is designed to be very specific for the healthcare professional that is taking the class, which is very important because in a normal Spanish class that is not customized, you're not going to learn like body parts, internal body parts, or for nutritionists, you're not going to learn words for specific minerals or nutritional issues that would come up. And then in the conversation classes, we use that specific vocabulary that you've learned to then also role play situations that you would encounter. So for instance, if you were a nurse, you could talk to the patient about how to take your medication, or you would talk about procedures, or you would talk about ways that the patient needs to go home to take care of, say, a wound or something of that nature.
Right.
And it gives the student the opportunity to put in practice all the vocabulary they learn.
So in addition, Kukulcan offers, as part of the healthcare program, workshops in traditional medicine, which is a very important part of Mexican culture. Approximately 70% of the people in Mexico use traditional medicine rather than going to physicians and hospitals as we would ordinarily think of as healthcare in the United States. These workshops deal with issues such as spiritual healing and herbal remedies that people might use.
And we also have visits to different local hospitals, orphanages, and shelter homes, which gives the opportunity to students to see the difference between Mexico and their countries.
As an example, yesterday we went to the orphanage here in Cuernavaca, and the nutrition students put on a nutrition presentation to teach the kids about the importance of eating fruits and vegetables.
And did the kids enjoy it?
Oh, the kids definitely enjoyed it. I think we stayed for an hour and a half after the presentation just playing ball with the kids.
And the kids said, "Now we are happy because our heart is happy. Nuestro corazón está feliz."
Wow, that's
good. That's excellent.
And what things do the students get to learn and to see during the hospital visits?
They basically get to understand the healthcare system of Mexico, which includes like the insurance and everything else like that, because it's very different than the United States. But in addition, the students get to actually take a tour through the hospital and see the various practices in the hospital to understand how they are similar and how they are different.
Another good thing about the program is that students stay with families and they learn about culture and the family aspects in Mexico, which is very different from the United States.
So Bruce, have you found that understanding Mexican culture also helps you when you're working with patients from other countries apart from Mexico?
I think it helps a lot because most of us have been raised in a single culture and think that that's the way everything works. Understanding Mexican culture better helped me to understand that I had a lot of cultures in my WIC clinics. For instance, I had people from Somalia, people from Ethiopia, people from Cambodia, and again, it was a whole new set of cultural issues that I had to deal with. For example, the women coming from Somalia were not accustomed to sitting in an office with a male, and that became a big problem in the clinic. But having experienced another culture like Mexico and beginning to realize that my culture is not the only culture, it really opens my mind to be more sensitive, I guess, to the cultures of those other people and to provide better healthcare.
So we've learned a lot about what's actually included in the program. Can you tell me, do any professional associations recognize the programs?
There are a number of professional associations that recognize the program and give continuing education credits, including the California Public Health Association North and the Texas Nurses Association. For dietitians, also the Commission on Dietetic Registration offers continuing education credits.
And what about for university students? Is there any way that they can get credits transferred to their own universities?
Under certain circumstances, students can get university credits through the University of Houston, University of San Diego, or the Metropolitan State College of Denver.
So it seems like there's an awful lot included in the program. There's a lot of activities, a lot of classes. Is everything included in the enrollment price?
Everything we talked about today, it's included in the price, except the optional weekend excursions to interesting and beautiful places near Cuernavaca.
Well, I'm sad to say that it's time to leave now, but I hope that we have been able to explain some of the details of the healthcare programs here, and that we've been able to communicate to our listeners just how extensive and thorough the programs really are, and of course such great value too. Now I would just like to say thank you to Bruce for all of his work here and for joining us today. Thank you, Bruce.
It has been my pleasure.
Thank you for coming today, Bruce.
Kukulcan is really a very wonderful place and a great place to learn Spanish.
And to you too, Carmen. Thank you so much for being with us. It's always a pleasure doing these podcasts with you.
Thank you, Cliff.
You're welcome.
It was a pleasure for me.
Okay, folks, that's just about it for today's show. But if you do have any feedback or comments, please drop us a line at podcast@kukulcan.com.mx. We'd love to hear your feedback, love to hear from you. And so finally, from me, from Carmen, and from Bruce,
Adiós, hasta luego.